Okay, so I am going to introduce our last but not least presenter to you. And she's representing GIBS, so you all know who GIBS is. Dr. Siviwe Mila, she's the Senior Manager of Medical Advisory Services at the Government Employees Medical Scheme, that is GIBS. And the topic is on screening and preventative care. Dr. Siviwe is a healthcare leader with extensive experience in clinical governance, medical advisory services, and health systems management. As the Senior Manager for Medical Advisory Services at GIBS, Dr. Mila is responsible for driving strategic healthcare initiatives, optimizing provider relations, and ensuring evidence-based policy implementation to enhance member health outcomes. She's got quite a long bio still, so I am going to just lead with her last one. Passionate about health equity, innovation, and sustainable healthcare delivery, Dr. Mila leverages her clinical expertise, data-driven decision-making, and stakeholder collaboration to support GIBS in providing accessible, high-quality healthcare for its members. Fabulous.
I feel like I need to run up the stage because I'm late.
You can run up the stage, do just what you want. Thank you.
Okay. Good afternoon. You know, when you're the last shift, it's just the shift before lunch, where people want to go and just like, make quick, hey, Ihlelo 15, the Xhosas would understand what I'm talking about. Good afternoon, everybody, and thank you so much. I think Dr. Ndilega deserves another round of applause. I think that was very, very informative. And always, coming to these talks, it's just like, Gems, you don't want to pay. So I don't have my bulletproof today. And I promise that my bodyguards at the back will try and come through for me because we always get it. But today I want to speak about something that's quite important. And I think, can I just quickly get an indication? I saw the GPs. Do we have any pharmacists, any nurses in the room? Nurse, yes. In the last, I said GP, and they were like, it's not just about GPs. And I had to be smart and said, no, Gauteng province. So, it's just, I come from GIBS. When we brag, chip on the shoulders, we're the biggest closed medical aid scheme. 2.4 million lives. But I think the biggest thing that's important about GIBS is that we serve the population of South Africa. From the person sitting in Kokodal, rural Eastern Cape, to the person that's sitting in a high exec office in Sandton. So that is a disease profile that you see, which is not generally what you can say about other medical aid schemes. We're currently sitting at 2.4 million lives, and our average age is about 49 for the principal members, and also the scheme age 32. So we've got a lot of young kids coming up. But I think what's quite important is when you're looking at the amount of conditions that we're covering, more than 3 chronic conditions per person. And it becomes very important, the value-based care systems, and also that integrated care that you're talking about. Because at the end of the day, we're talking about people. This are family members, this is a mom, this is a dad, and it's not just numbers. So it's important to just mention that we have disease management programs, and as much as this is a preventative talk, I thought that this would be important slides that while you're looking at value-based care and what's the best way to do it, we have implemented these disease management programs. And in these, we're able to see, okay, what's going on now with our diabetes? Are we adequately controlling them? There's a lot of improvement that can still happen, but one thing I know and I love about us is that we are always open to suggestions. It's an open book policy, open door, and even those GPs, you can knock, even you're a single GP. That's one thing that I love about the scheme, and I can confidently say we do listen and we will make up an appointment. So what's also nice is the spinal care that we have included. Not a lot of medical aid schemes are looking into the musculoskeletal, so those are all disease management programs, especially because when you're looking at our profile, nurses and doctors, Department of Education and Health, lots of people that get booked off backache, and it's never fully investigated. So that is one of our nice flagships, disease management programs when you're looking at the spinal care. So the important people in the room, including our nurse, family practitioners. I think this data becomes very important that GPs, family practitioners are the backbone of primary healthcare in South Africa. yes, I understood, the elements of people still having to travel 100 kilometers. I hope, though, in this context of South Africa, that there are not a lot of people that need to do that, because even as Lalini, you've got GPs, even if it's one GP. So you might travel 20, 30 kilometers on gravel, like where I come from. For me to get to town, I need to be on gravel for 20 kilometers and pay 50 rand to go see a doctor. And that's still a barrier of entry for our people. And that's why I said with GEMS, that is very unique, because this person is on medical aid, but they still have got the same challenges as someone who is being serviced by the state. So when we're looking at within the GEMS profile, we've got family practitioners, and the role, as I said, is very quite significant, because you guys are the backbone of sustainable healthcare. And just around about 2023, 4.2 billion was paid to family practitioners from the GEMS. This is about 8% of the expenditure of the whole scheme. So you can see how vast they are. And about 1.8 million patients are seen. So this is about 80% of beneficiaries. So if you're looking at how many consults that is per beneficiary, that's about 3.5 consults per year that GPs are getting. And this is one that we pride ourselves about, what our flagship. As I said, we service so many different people. And Tanzanite One has become that offering in the scheme where people that would not afford medical aid, the cleaner who will not afford medical aid because of the amount that they're getting, gets on medical aid and gets covered for majority of staff. So 36% of GP beneficiaries are on options of unlimited family benefits. And I'm so glad that Dr. Ndilega spoke about fraud, waste, and abuse. So with that unlimited, some of our colleagues, they tested. There's one case in KZN where you've got 52 weeks in a year, right? This person was claiming for 54 consultations for a family member of 6. So that practice got caught out in fraud, waste, and abuse. Because how many times is everyone, family of 6, coming to visit you? But yeah, as we usually say, the culprits are generally never in the room in these occasions. So unfortunately, there are times where you're going to see, now it's kept to 15, but after 15, you can motivate, But it was just like, you never thought it would happen until then someone's like, loophole, let's do this. And then unfortunately, it results to that. But on top of that, 42% of GEMS beneficiaries are on options where they can nominate their general practitioner. And that becomes important. So if you have positioned yourself that you will have a dietitian on a certain day, and just to say we do pay for dietitians, most of the things what happen is that they don't claim the right tariff codes. That is the biggest thing that generally happens. But for dietitians, we do claim. And one of our fraud, waste, and abuse cases actually was a dietitian that claimed 1.2 million in 1 month. So, yeah. So it's very interesting cases when you become the SIU and investigate things that are happening. So this is just to say that the scheme has really improved its beneficiary and the preventative and screening elements. And it becomes important, I'm glad we've got a nurse in the room as well, that it's just not limited to family practitioners or doctors, but even your pharmacies. We know now, people are moving to telemedicine, and some people, because they don't want to wait in lines for a GP that's got 30 more patients to see, it's convenient that I'm going to go into a mall and I'm going to go into a pharmacy and someone's going to be able to cater for my needs. And the unique thing about these preventative care elements is that it's not coming from your day-to-day, and it's coming from preventative care. And what's the important thing about these conversations is that when you guys go out there, when you speak to your peers, please use this uptake, because we're able to see the data in the background. And flu season is coming up. That's one of the things that, how do we push even our people that are about the age of 65 to get the pneumococcal vaccine, because it's covered. But unfortunately, most of the time, there's a whole lack of information not generating all the way down. So the plan also is to increase preventative and screening up to by 2026. So this is just information that comes from the World Health Organization. You don't know the benefits and the programs that are there for screening. And we know that it will reduce mortality. The beautiful stats that Dr. Ndilega showed, that of that HbA1c, like so many people were caught before time, and actually that target organ damage that could have happened was actually reversed. So we all went into medicine somehow to help people, and this just brings it back, and that this is a benefit that is already there year after year. But why is it that you're just not extending and giving it to our beneficiaries and to your patients? So the whole idea is to decrease to reduce the incidence of conditions being identified and precursors, and also that the severity of the conditions is not bad. As you know, she alluded the example of someone just rocking up in ER now, dealing with the whole DKA, and it's much more expensive to treat a DKA than if you were dealing with pre-diabetic and then working them to try and reverse. So these are a number of tests that we currently cover. As I said, that GEMS is open to certain suggestions. So I know, so let's just start with the flu vaccines. So the flu vaccines and also HPV. So with HPV, we're going to speak about it. So just a little bit that the age now has gone up to the age of 45. I mean, someone still said, like, why aren't you going all to the age of 60? So with our population and also when you're working with funders, you really need to look at something that's going to be able to be sustainable. So we've increased it up to 45 currently. Pneumococcal, as I said, that's generally for populations up to above the age of 65. So childhood screening, these are the ones that we don't generally do. Even for me as a parent, hey, I'm guilty of that one. The school will tell you that there's an audiologist coming, like, can you sign up? You pay so much money. And yet, actually, every month, I'm already paying for this. And yet, it's just something that I've not done. And even just with the optical, I'm just like, okay, can you read? Your marks are good, so you don't have eye problems. So those are the type of conversations we should be having, even just as the people that are giving out information. NCDs, we know South Africa, we're a ticking time bomb with NCDs. So how do you just use that as well, even if it's not just for wellness days in the screening elements, but even just you've got a whole file. How do you say, hey, Baba, bring your son, bring your daughter, bring everyone. Let's just do a day where even in your practice, you just say, okay, this is a family day. We're doing screenings. Maybe you categorize them according to alphabets, but just those innovative ways on how you actually screen your people, you get compensated, we get the data, and then you see how best do we work with everyone. So looking at pap smears, PSA, I know the fecal occult blood, many people just want to go straight for the C-scope, but unfortunately with us within the scheme, we still have to go through the route of fecal occult blood because, yeah, as I said, fraud, waste and abuse, there's very interesting things that happen out there. But mammograms is another one, and also we're looking at entertaining other screening methods besides just that. But aging population, bone density scans, I mean, like with the people, how many of the GPs have you done a bone density scan for your people? Any GPs that have been doing bone density scans? And also the things with GEMS, you've got a lot of population that's in the pensioners group. So this becomes very important with them, and especially because they tend to be on the higher plan, which is Onyx for the members. Another one, syphilis testing and screening, especially South Africa around December. Yeah, no, we are a very fun country. So just hold it in there just to make sure for control that your people, they are sorted. And a beautiful thing about GEMS as well, when you're speaking about pre-exposure prophylaxis, you can register your members to be on PrEP under the HIV program. So it's just to say that you are not HIV, but like you will get your ARVs on a monthly basis under. So it won't be coming from your day-to-day, but it will be coming under. So that's one of the things that we are big on. And yeah, so if you're having that, please also. Then we talk about TB testing and HIV testing, which is generally the South African bread and butter, and dental screening. I think this is another one, just like with optical and hearing, that we don't utilize a lot, and especially because lots of medical aids don't tend to have a lot of benefits when it comes to dental. So now that is implemented, went up for our kids. So this is just what I spoke to about in terms of increasing the ages from 2024. And then also now, when you're looking at dental sealants, between the ages of 3 and 9, that's what's been included for Ruby, Emerald Value, and Onyx plans. Then our future looks at mental health services screening, because we're seeing a lot of uptake in mental health cases, people being admitted, and yeah, so we're doing something in the background. So something is cooking, and also BMI screening, because also there's a pilot that we're running, I'm very happy about, an obesity program, where we have got a set number of people in the program for about 2 years, and we're going to see what their outcome is, and we'll see how we can best implement that, because it becomes very important for the country. So these are just numbers to show how we need you. We need your help. We need you to claim these benefits, because the data is very, very little. So if you're looking at influenza vaccines, this is any from children that are above 6 months. So from 2022, that was the highest that we've had for the last 5 years. And you remember this is around COVID time, so people were very cautious, they wanting to vaccinate. But that has dropped from 52%, from 5.2% to 4.4%. Pneumococcal, also the uptake has just generally been quite low at 0.5%. But HPVs, those are ones that also has been coming up slightly, but not well enough. So if you've got a 9-year-old, please, I know in South Africa, the moment the minister came out with this a couple of years ago, it was a whole blast, like, no, children are not sexually active, and it's got nothing to do with that. And I think that's where the education becomes important, because if you're talking to me as a mom who knows nothing about medicine and you want to give my child an injection so that they don't get cervical cancer, I'm like, yeah, but they're not even there yet, don't give it, But yet, the data shows that if it's given quite early on, they're not going to tell you when they start having sex. So just make sure be protected before it happens. So also then this one, we've been doing good strides, especially when it comes to the prostate antigen testing for PSA. And we know, especially in a country like South Africa, where abantu abafana nabo Babu Desmond Tutu were quite open about their journey with prostate cancers. And this is one of the cancers that if you pick it up quite early, a lot can be done. And even when it does get picked up late, a lot can be done still. But I think we can still do great uptake. And I always say with the men, I was speaking at a SAPS conference, and I was like, don't worry, it's not the finger anymore, it's just a blood prick, because I think a lot of men still fear that they will need a whole digital exam. So also just having that conversation with your patients becomes very important, because we know men generally don't come to see you. If they see you, the wife is there, or they're very sick. Those are the only two options that a male is going to come. So when they're there, make sure you do everything, just summer right there and then. Pap smears between the ages of 12 and 65. So also just this one has dropped. It's something, we know around October, we're talking about cancers, there's a pick up. So yeah, if you've got a little bit of extra time, just like, ma'am, okay, you've non-running periods, can we just quickly do this? And then it's out of the way. So we really need you guys to be the champions of these, because it's benefits that are available to our beneficiaries and your patients. Mammograms above the ages of 40. I know this is still very uncomfortable for a lot of people, but it's also there. This is just an interesting health quality report in terms of what's happening in the industry and what's happening within us. So if you see, when it comes to HIV, we're generally doing quite well. And I think it speaks to also what I said in the beginning about our population being vastly, being a good demographic of South Africa. And we know we've been HIV. Well, as much as Trump tries with what he tries, I really think as a country we're still going to be okay in terms of our HIV programs and the progress that we have made, especially since after the early 2000s. However, you'll see that with the flu vaccines uptake, we are lagging behind. The industry sitting close to 20%, we're at 15%. Pneumococcal, almost just par on par. Cervical cytology, pap smear, so the industry is quite higher than what is actually happening with us, and also with the mammograms and the bone density scan. But the percentage of beneficiary visits to the dentist with us is a bit higher, and that's a nice thing as well, that we do have those dental benefits, and generally you don't get them in a medical aid portfolio unless you have to add it additionally or you're in a higher and expensive plan. This is just a slide to show you the uptake of the different tests and according to the different options that you have. So if you see Tanzanite 1, so these are generally, we could say, your lower LSM type of patients, and your Onyx, it's mainly higher, and also the older population, so mainly your population that are more into the pensioner group. What is also nice is seeing the Emerald value coming up, so that is one of the flagships that were launched a couple of years ago, and it's had a great uptake. So if you see the flu vaccines, it's almost like the higher groups are able to to have a much more higher uptake of these vaccines. And I mean, stuff like education is a big element of it. Do they know about it? You know, they're probably not taking it because they don't know about it. If you are sitting, as someone said, like your worries about you need to go to work, you don't have time for this, but how do we have those conversations that are comfortable enough that, okay, when you do come to collect your treatment, your script next time, then we will going to do an HPV test, HPV vaccine. Next time when you come for another 6 weeks, or checkup, then we're going to do this test, so that you stagger it, that they don't feel like you're wasting a lot of their time, you don't feel like they're taking a lot of their time, but within that 1 year, these are all the tests that we have done, and also with the electronic systems and also the record keeping that you have, that everything is in place. So this is just all beneficiaries not receiving services. So you see there's a lot of beneficiaries. So you'll find that also main members are generally the ones that are receiving because they know about the information, but the beneficiaries don't tend to know about the things. So those are things that we have identified as a scheme and also seeing how best to improve. So this becomes very important, the barriers. So the lack of awareness, and I mean this cuts across. It cuts across to practitioners, it cuts across to even our patients, and access to the health services, the transportation and childcare element. And we're speaking about South Africa, where we've got real challenges of transportation, challenges of costs going up, and the cost of living, cultural and linguistic barriers. I mean, one of the other things that I do when I'm not at GIBS, I'm at Radio 2000 on Tuesdays at 8 p.m. And it's very interesting when you're on that lifestyle show, how many people call in when you're just explaining small things like high blood pressure and explain it in a language that they understand and actually what it means for them in their body. Then they take part in terms of like, oh, doc, so I must not eat muroko or so. I must not eat papa etweu. Rather, the brown one is better. So those small things and even being able to speak to the patient in their language goes a whole long way, because then they become a part of their treatment and you improve the adherence element and the compliance to the medication. Because right now they just find it, a lot of people would say, no, the doctor just gave me this and they said go away. And I always say, no, but have the conversation, because most of the times they're trying to push numbers, especially in state, but if you have the conversations that, no doc, I've done this and I've done this, I'm not happy, these are my numbers. And even just patients understanding, what does the top number mean, what does the bottom number mean? Those simple, because they'll be like, the blood pressure was high. Okay, what number was it? They just said it was high, So those small things go a long way. Fear and anxiety. I mean, we as South Africa come from a context of HIV, and I mean around about the early 2000s and late 90s, it was really bad. It really, really was bad. So I think there's still a lot of stigma when it comes to HIV. I personally think we should not be consenting to do HIV tests, because you don't consent for an HbA1c and you tell someone they're diabetic, So, but anyway, that's just my personal view. That's not James's view. Please don't quote me on that. But I really think there's a lot of ground we still need to do when it comes to the fear and anxiety element, especially with diabetes, because for your men, they're going to be like, yeah, doc, so izovuka, am I still going to be able to satisfy my wife? They're just thinking about ED. That's the very first thing, when you tell them diabetes that they think about. Healthcare provider factors, so also the elements that we spoke about, inadequate provider recommendations and communications, and also our patients being forgetful. If you pick up, they're not taking their medication. Is there a reason? Do they need a pill count? Do they need, so those small things that you might think that they don't matter, but actually they go a long way. And social economic disparities, limited access, and socio-economical issues, and the stigma element I spoke about. So this was just an interesting paper showing how when you're looking at preventative care, there's still preventative services rather, there's still a low uptake on it. And it found a number of factors, and that sometimes, as practitioners as well, we're not focused on preventing disease, we're focused on curing, or it's already there. And that the focus should be more on the preventative element. And also then with funders, how do you get compensated by preventing a hypertension from happening, and looking at those VBC models. So those are the ways that I think the health is generally looking, especially with health services. Okay. And I think I'm closely, coming off to the slides. And I think the biggest thing is the educational outreach programs. I mean, we have those within GIBS, but also peer-to-peer counseling and member and provider communication. So we're trying to improve our communication channels within the scheme, SMSs, emails, and also now we're now working on WhatsApp channels, especially for the people that are on the disease management programs. Pop up to remind you that you've got your script coming up soon, how your blood's looking, you're due for your 6-month blood supply, and also self-testing and HIV for HPV. So those are things that we're currently entertaining and looking at. This is just more on measuring outcomes. So when you've got the data and you collect the data, it's very easy to measure those outcomes. So just, I think, hammering on what was already said, it's quite important that you do have those data channels, and especially those electronic record systems. With what's happening with possibly the NHI, position yourself, because no matter what we say, some form of it is going to come, no matter what it comes in. But like, how do you prepare yourself, especially with the data element, and making sure that we improve the survival period or improve the quality of adjusted life years. So yeah, that is me. I don't have a fancy QR code like Utogotela. I'll tell James that we need a QR scan. Thank you.
Thank you so much, Dr. Siviwe. Any questions from anybody? Everybody's tired now. Dr. Siviwe, thank you so much. That was a very informative presentation. If anybody needs more information, you are welcome to contact us and we can get you into contact with them.